So, topic for today's lecture is sterilization and disinfection. So, what is sterilization? It is a process by which an article's surface or medium is freed from all microorganisms, either in vegetative or spore form. It is different from disinfection. What is disinfection? It is a process which reduces the number of viable microorganisms to an acceptable level, but may not inactivate some viruses and bacterial spores. So this is the difference between sterilization and disinfection, where in disinfection the number many types of microorganisms can be reduced by the process, but we cannot inactivate bacterial spores, which are the most heat resistant bacteria. So these bacterial spores, even these bacterial spores, we can destroy or we can remove or we can free it from any surface in the procedure of sterilization. So this is the main difference between sterilization and disinfection. What is antisepsis? It is a antiseptic is a chemical which can be safely applied to skin or mucous membrane surfaces and used for preventing infection by inhibiting growth of bacteria. So this is the difference between sterilization, disinfection, and antisepsis. Next slide. Why is infection control important in dentistry? Both patients and dental healthcare personnel can be exposed to pathogens. Contact with blood, oral and respiratory secretions and contaminated equipment occurs. Indirect contact with contaminated instrument or surface occurs. Direct contact with blood or body fluids can happen. Contact of mucosa of the eyes, nose or mouth with droplets and spatter can happen. And inhalation of airborne microorganisms also can happen. So for all these things, the important thing is infection control. If we do it properly, then there will be no harm to ourselves as well as patients. What are the exposure risks in dental laboratory? Airborne contamination, hand to surface contamination, cross infection, patient vulnerability, and personal vulnerability. So we'll discuss each and everything one by one. So if we are talking about airborne contamination, how it happens, a high-speed handpiece is capable of creating airborne contaminants like aerosols, mists, and spatter. These three things are very dangerous, and these things helps for the contamination. What are aerosols? These are invisible particles ranging from 5 to 50 microns, remain suspended in air for hours and can carry any respiratory pathogens to the lungs. So, in recent pandemic times also, these aerosols are dangerous for the spread of COVID-19 virus also. So, in the Dental Advisory Committee, it has been decided that to reduce the minimum use of aerators to
So watch me. Bring back.
eliminate the number of aerosols. So what are the mists? Mists are droplets approaching 50 microns or more. They tend to settle gradually from air after 5 to 15 minutes. Both aerosols and mists produced by cough of patient with unrecognized active pulmonary or pharyngeal tuberculosis are likely to transmit the infection. So aerosols and mists are the very important contaminants which can contaminate from patient to the surrounding environment. Water spatter, these are particles larger than 50 microns and are visible. They have a distinct trajectory, usually falling within 3 feet of patient mouth. Spatter has a potential of causing infection of dental personnel by blood-borne pathogens. Next thing is hand-to-surface contamination. With saliva-contaminated hands, the dentist could repeatedly contact or handle unprotected operative surfaces, and hand-to-surface contamination may happen. Be it use of amalgamated light curing devices, camera equipments, mobile phones, personal computer, keyboards, mouse, all these things. Then next thing is cross infection. The transmission of infectious agents between patients and staff within a clinical environment is called as a cross infection. So this type of transmission may result from person to person contact or via contaminated objects. Then next thing is patient vulnerability. Although infection risks for dental patients have not been as well investigated as those of hospital patients, but when dental personnel experience exposure of saliva, blood, and possible injury from sharp instrumentation while treating patients, they are more vulnerable to infections. The next thing is hand hygiene. In these recent pandemic times, also we are very much conscious about hand hygiene. We have been reading about hand hygiene since so many years. The importance of hand hygiene is now been highlighted in these pandemic times. So wash hands before putting on gloves and immediately after removal. At beginning of treatment, jewelry and drinks should be removed. Long fingernails can harbor pathogens and nails should be kept short. And treatment room sinks be equipped with hands-free faucets that are activated electronically or foot pedals. So hand hygiene is very important. Use liquid soap as bar soap may transmit contamination. Waterless antiseptic agents are alcohol-based products available in gels, foams, and rinses. Nowadays, you people might be using it in the form of sanitizers. Hand cleansers containing mild antiseptic like 3% PCMX, that is parachloromethazolinol, and chlorhexidine. The next thing is personal barrier protection. How to protect ourselves? We have protecting clothing, protective eyewear, surgical mask, and gloves. Now, requirement for protective clothing. How it should be? It should be made of fluid-resistant material. To minimize the amount of uncovered skin, clothing should have long sleeves and high neckline. Buttons, trim, zippers, and other ornamentation should be kept as minimum as possible. What are the guidelines? Not worn out of the office for any reason. Protective clothing should be changed at least daily and more often if visibly soiled. If a protective garment becomes visibly soiled, it should be changed immediately and washed away. Hot water, temperature ranging between 70 degree to 80 degree, and or cold water containing chlorine can be used to provide antimicrobial action. Then protective masks worn over the nose and mouth to protect from inhaling infectious organisms. In recent times, we all have been using this mask. A mask with at least 95% filtration efficiency for particles 3 to 5 micrometers in diameter should be worn whenever splash or spatter is likely to contaminate. So these are the important things: masks, protective clothing wears, and gloves. Medical grade non-sterile examination gloves and sterile surgical gloves are medical devices that are regulated by FDA. Different types of gloves are used in a dental office, like examination gloves, surgical gloves, over gloves, utility gloves, non-latex containing gloves. people which have latex allergy, we can use latex free or non-latex containing gloves for them. What are the guidelines for the use of gloves? Gloves should be of single use. They may not be washed, disinfected, or sterilized. Gloves do not replace the need for hand hygiene, so wash hands before donning gloves and upon gloves removal. Open new, fresh gloves just before starting procedure. Replace damaged gloves immediately. Do not wear jewelry under gloves. Remove contaminated gloves before leaving the chair. How to remove gloves? Pull off the glove, inverting it. Both gloves can be removed simultaneously in this manner, shown in this picture here. Alternatingly, after removing one, insert bare fingers under the cuff to the grasp and pull the remaining glove and safely. And then again wash hands after removal of the gloves. So these are the important steps. Contaminated needles and other disposable sharps must be placed into a sharps container. The sharps container must be puncture resistant, closable, leak proof and color coded. So these sharps containers must be located as close as possible and always use the single handed scoop technique or some type of safety devices. Now operatory asepsis. All these things were about personal protection. Now we'll discuss about operatory asepsis. Design of the premises and the layout of the dental surgery and treatment areas are important factors in implementing successful infection control. Dental operatory and the instrument reprocessing rooms must have clearly defined clean and contaminated zones. Floor coverings in the dental operatory must be non-slippery and impervious with sealed joints. Computer keyboards should be covered where possible in treatment areas and cleaned regularly in non-treatment areas. Now, water lines and water quality. Microbes exist in the dental unit water line as biofilm. So bacteria may include atypical mycobacteria, Pseudomonas and Legionella. So CDC has recommended that dental unit treatment water contain less than 500 colony forming units of bacteria is acceptable. 500 CFU per millimeter of bacteria is acceptable. So disinfectants such as iodophor or diluted sodium hypochlorite that are used to clean these water lines and water units. All water lines must be fitted with non-return valves to help prevent retrograde contamination of the lines. Air and water lines from any device connected to the dental water system that enters the patient's mouth should be flushed for a minimum of 2 minutes at the start of the day and 30 seconds between patients. What about office design? Office design split into three distinct areas. Number one, operatory area, dental bridge assistant area, sterilization and storage area. Now instrument processing. Before sterilization or before disinfection, these are the important things. The steps involved are pre-soaking, cleaning, packaging, then sterilization and then drying and cooling. So these are the levels or you can call it as categories of patient care items. Critical, semi-critical and non-critical. What are the examples for the critical category? Periodontal scalers and curettes, burrs, surgical instruments. Examples of semi-critical items, mouth mirror, amalgam condenser, reusable impression trays. An example of items for non-critical category, blood pressure cuffs, stethoscope, radiograph tube, head and core. Okay, so these are the categories of patient care attempts: critical, semi-critical, and non-critical. You can write these things down if you have pen and paper. Three types of categories. Number one, critical. Number two, semi-critical, and number three, non-critical. In critical category, you can write periodontal scalers and curettes, burrs, surgical instruments. In semi-critical category, you can write mouth mirror, amalgam condenser, reusable impression trays. In non-critical category, blood pressure cuff, stethoscope, stethoscope, radiograph tube head or cone, radiograph tube head or cone. The next thing, pre-soaking. First step. What is pre-soaking? Most disinfectants do not act in the presence of debris, so they should be removed. It is easier to remove the debris before it dries. Placing the instrument in a pre-soak solution until time is available for full cleaning prevents drying and begins to dissolve or soften the debris. So pre-soak solutions used are detergents, enzymes, phenols, or quaternary ammonium compounds. These are the pre-soaking agents. Pre-soak the instruments, clean them, and pack them. And after that, the most important step, sterilization. Most instruments contact mucosa or penetrate oral tissues. It is essential that reused instruments thoroughly cleaned and sterilized by accepted method that can be routinely tested and monitored. So what are the accepted methods of sterilization? Number one, autoclave. We call it as steam under pressure sterilization. Steam under pressure sterilization, that is autoclave. Then chemical vapor pressure sterilization. Chemical vapor pressure sterilization, we call it as a chemiclave. Then dry heat sterilization. Dry heat sterilization, we call it as a dry clave. And next thing is ethylene oxide sterilization. Ethylene oxide sterilization, we call it as a etox sterilization. Etox sterilization. First thing, autoclave. Sterilization with steam under pressure is performed in a steam autoclave. The temperature used is 121 degrees Celsius for 15 minutes and under 15 lbs or 15 pounds of pressure. If we want to reduce the time, we have to increase the temperature and pressure. So here in the second category, the time has been reduced to half from 15 minutes to 7 minutes, but the temperature has been increased up to 134 degrees Celsius temperature, and pressure is doubled to 30 pounds or 30 lbs. The advantages of autoclave are most rapid and effective for sterilizing cloth surgical packs and towel packs. But the items sensitive to heat cannot be sterilized. This is a disadvantage, and it tends to corrode carbon steel burrs and instruments. So how to disinfect burrs in autoclave? Burrs can be protected by keeping them submerged in a small amount of 2% sodium nitrite solutions. Okay, so the solution should be above the burrs by approximately 1 centimeter, and we can sterilize burrs in autoclaves by keeping it in a 2% sodium nitrate solution. Sterilization of handpieces. Autoclave sterilization is the most rapid method for sterilization of handpieces. If proper cleaning and lubricating are performed as prescribed by the manufacturer, the sterilization of handpiece is obtainable, and we can do it in a regular autoclaving. The used or preferred methods for sterilization of handpieces are ethylene dioxide gas sterilization or chemical vapor pressure sterilization. Now coming to chemical, here it operates at 131 degrees Celsius of temperature, 20 pounds of pressure, and time required is 30 minutes. So what chemicals has been used in these chemicals are formaldehyde and alcohol formulations. These are water-free formulations. Again, the carbon steel and other carbon sensitive burrs, instruments, pliers can be sterilized without corrosion. This is the disadvantage. This is the most important advantage of chemical. But the disadvantage is items sensitive to elevated temperature again cannot be sterilized in chemical. Towel and heavy clothing cannot be sterilized also. The next thing is dry heat sterilization. In dry heat sterilization, most common time temperature cycles are 170 degrees Celsius for 60 minutes, 160 degrees Celsius for 120 minutes, and 150 degrees Celsius for 150 minutes. Recently, more rapid dry heat sterilizers, we call it the Cox sterilizers, have become available, and these can be operated at 370 degree Fahrenheit for 6 to 8 minutes or 12-minute cycles. Advantages for these carbon steel instruments are and burrs do not rust and corrode and lose their temper or cutting edges if they are well dried before processing in dry heat sterilization. Again, high temperatures may damage heat sensitive items such as rubber or plastic goods, and sterilization cycles are prolonged at lower temperatures. These are the disadvantages. Next is ethylene oxide sterilization. Best method of sterilization of complex instruments or delicate instruments like handpieces. Ethylene oxide sterilization is the best method. Automatic devices sterilize items in several hours and operate at elevated temperature well below 100 degrees Celsius. These are less expensive devices, operates at room temperatures to sterilize overnight. Disadvantage is units with large chambers hold more instruments or packs per cycle, and disadvantage is porous or plastic materials absorb the gas, so it required aeration for 24 hours so that they will be safe for use to contact skin or tissues. Boiling water does not kill spores or cannot sterilize instruments. In case of sterilizer breakdown, this method should be followed, but boiling water is not an ideal method for sterilization or disinfection. Endodontic instrument sterilization, proper steam autoclaving, reliably produced completely sterile instruments. Salt sterilization or glutaraldehyde solutions may not give adequate sterilization, but they provide good disinfection. Files sterilized by autoclave and lasers were completely sterile. Those sterilized by glass bead sterilizers were 90% sterile, and those with glutaraldehyde were 80% sterile. So you can use autoclaves, glass bead sterilizers, or glutaraldehyde formulations. The next thing is disinfection of impression. Before disinfection, dental impressions must be rinsed to remove debris, saliva, and blood under tap water for 15 seconds. And this is a chart in which they have shown if the type of impression material is alginate, we can use iodophores or 0.5% hypochlorite. If the impression material is polysulfide, again we can use iodophore and 0.5% hypochlorite solution. If it is silicone, immersion in any disinfectant is possible, feasible. If it is polyether, spray and wrap in iodophore, or you can use 0.5% hypochlorite and phenolic disinfectants. If it is a hydrocolloid, immerse in iodophore and 5% hypochlorite. And if it is an impression compound, again you can use iodophore and 0.5% hypochlorite solution for disinfection. This is the last part, sterilization monitoring. There are some biological indicators where you can use bacillus, and these dried bacillus uh, can be kept in a monitoring way of sterilization. There are chemical indicators like color changing strips or tapes which show the if your autoclave or your sterilizing device is working properly or not. Physical indicators like routine observations of dials, gauges, indicating time, and maintaining the book which records the time, temperature, and pressure. These are the physical indicators. So these three indicators, physical indicators, chemical indicators, and biological indicators, are useful for the monitoring of your sterilizing units. So we'll stop here. This is all about sterilization. Stay home, stay safe, take care. दादा